Hello, and welcome to Mental Health Matters. I'm Edgar Wiggins, your host for this program that is dedicated to providing you practical and useful information regarding mental health issues and needs. A mental health crisis can occur at any time and in any setting, community setting, work, your home. Here to help us understand what can be done in a crisis is Dr. Diane Ossip, who's a board-certified psychiatrist, has been practicing for 20 years, and is the medical director of Baltimore Crisis Response Incorporated. Hello, Dr. Ossip, and welcome to Mental Health Matters.
Good morning.
I think a good place to start would be for you to talk about what Baltimore Crisis Response is and what it does for the community.
Baltimore Crisis Response is a community-based organization that provides acute psychiatric services and substance abuse services to the citizens of Baltimore City.
What kinds of services does Baltimore Crisis Response provide?
We have multifaceted services. We begin our services with the hotline, which is a 24-hour, 7-day-a-week crisis hotline where consumers, family members, providers can contact our hotline and access our services. From there, a team of crisis providers, including social worker and a psychiatric nurse, are dispatched to the site where the crisis is occurring to provide an evaluation under the supervision of a psychiatrist. Services can be provided either in the home or on our 24-hour, 7-day-a-week crisis residential service.
Well, let me stop you there because I'm old enough to remember as a youngster, when I wouldn't be feeling well and my mother would call the doctor and the doctor would come out to the house with his little black bag and would examine me, and then if medication was involved, would give me some medication, and I'd stay at home. So are you saying that somebody in a mental health crisis could call this hotline and a team would come out and the same kind of thing would happen where the person would actually get services in their home?
Absolutely. The organization is providing services in the least restrictive manner, in the least restrictive setting, non-hospital based. So we very readily will provide mental health evaluation and services in a patient's home.
Wow, that's really something. How effective is this kind of service for people in a crisis?
Well, actually, it's very effective. The services are provided very soon after the call is made to our hotline, so it eliminates a long waiting period, typically in the emergency room, or waiting for an appointment in a mental health clinic or in a doctor's office, which typically can be several days to several weeks. So in a crisis, the services are provided almost immediately.
Wow. Well, that's really interesting. Let's kind of back up a little bit, though. Does everybody need a mobile crisis team to come out to their home? What about calling the hotline and simply talking to a trained and compassionate counselor? Does that sometimes give the person what they need?
Absolutely. The hotline counselors are trained to triage the calls. Sometimes patients, family members, consumers will get enough support simply from making a call to the hotline, accessing the services, finding out what resources are available to them. If, however, the hotline counselor feels that the level of the crisis or the emergency or the acuity of the symptoms warrants a visit from our team, then a team will go out and can do a face-to-face evaluation, which is often very effective.
Now, I understand that the hotline as a service gets anywhere between 30 to 35,000 calls a year. I also understand that in some situations, people are in a great deal of distress and often talking about perhaps suicide. Is the hotline effective in terms of working with people in a suicidal crisis?
Absolutely. The hotline counselor, based on the conversation they're having with the person over the telephone, can understand the level of the crisis. If they feel like it's a true emergency and something immediate needs to be done, they can, through the telephone system, access the 911 operators and have police dispatched immediately, often while they're keeping the person on the telephone, to the site of the emergency.
So in that sense, the hotline of Baltimore Crisis Response Incorporated can be a real life-saving service.
Oh, definitely. Not only for suicide, but for other emergencies and crises. The hotline is very effective, and it is definitely life-saving in lots of situations.
Now let's go back to the team. So this mobile team goes out to meet somebody that they've never spoken with before, who is in crisis and needs some kind of assistance. They go into the home. What do they do?
Well, the mental health counselor will engage the patient, often the family members, do a psychiatric evaluation assessment. Our psychiatric nurse will also do a somatic assessment. And together they will present the case to a psychiatrist by telephone, and from there a treatment plan will be established. A decision will be made as to what level of services this person needs.
So when we start talking about level of services now, we have some choices. One is the person can be left in their home, they can be treated. One of the other options is that they could be brought into crisis beds. Can you talk a little bit about the crisis beds and the service that they provide?
The crisis beds provide an alternative to inpatient hospitalization. It's a 24-hour residential program where we have a multidisciplinary team interfacing with the patient, providing mental health services. Patients receive individual counseling daily, group counseling, dual diagnosis treatment. Patients are seen by a psychiatrist daily, and we have very assertive case management that assist the patient with resources in the community, obtaining benefits, and linking them with services in the community for ongoing treatment and stabilization.
Now, when you talk about dual diagnosis services, what are you talking about there?
There we're referring to a combination of acute mental health issues as well as substance abuse or addiction issues. And these two tracks occur in parallel. So we're not treating just mental health or just addictions in isolation. We're seeing the patient in totality in terms of all the issues that are coming together for that individual.
One of the things that I understand about Baltimore City is that Baltimore City has a very high rate of substance abuse. I understand that about a little better than 9% of the population in the city have some kind of ongoing substance use issue. That equals about close to 70,000 people who are actively involved in using and abusing substances. So I would imagine then that when you talk about providing crisis services, that it's important for the teams to understand not only the mental health crisis, but also the substance abuse crisis as well, and how these two issues interact.
Absolutely. Baltimore Crisis Response also has a 16-bed program for a medically monitored detox and addictions treatment. And this is all under the umbrella of Baltimore Crisis Response. If the patient presents with acute addiction issues needing a medically monitored detox, they will be admitted first to our detox program, and if there are ongoing dual diagnosis issues, as we talked about previously, they can be transferred to our crisis residential program for ongoing dual diagnosis treatment.
What you're describing here is, at least in my opinion, a very comprehensive crisis service. There's a hotline where people can call in and talk with someone and get some information about resources. They can also talk to a compassionate, knowledgeable counselor. There are also teams that will come out and meet them in their homes or other locations and begin to engage the person. If that's not enough, then there is a higher level of care where the person can actually come into either a residential crisis bed, have their mental health issues looked at, or they can come into a service that focuses on addictions treatment issues. That's quite comprehensive. Is there anything like this anyplace else in the country that you're aware of?
I don't believe there are many programs in the country where all of these services are under the umbrella of one agency, one organization that provides this kinds of comprehensive, multifaceted treatment. There are some agencies in the country where the crisis services are more police-based, but we're an independent organization that works as a multidisciplinary team.
Well, we're going to need to talk some more about this so our viewers can understand the scope of Baltimore Crisis Response and all the services that we provide. But we're going to take a short break, and we'll be right back.
Bachelor number 1, how would you advise me to structure my investment portfolio?
I would say be cautious and invest in government bonds, money markets, and CD accounts.
Bachelor number 2,
I'd say at your age to invest fully in high-yield stock.
and bachelor number 3.
I'd diversify your investments. It would make your overall portfolio more balanced and can minimize your risk.
Okay, there you go. Now it's time for you to make a date.
Bachelor number 3.
Bachelor number 3.
Remember, make a date today to diversify your portfolio and choose to save.
Hi, I'm Colonel Terrence Sheridan of the Maryland State Police. This is a special alert for motorcycle riders. The number of motorcycle riders has increased dramatically. Unfortunately, so have the number of motorcycle crashes, injuries, and fatalities. Speeding, inattention, drunk driving, and inexperience are significant factors in these crashes. Please make sure you have the proper training, equipment, and attitude whenever you're on two wheels. For more information, visit ChooseSafetyForLife.com.
In our nation of plenty, 1 in 5 children faces hunger every day. America's Second Harvest feeds 23 million people every year. 9 million are children. Help feed a hungry child. Volunteer at a food bank or pantry. Organize a food drive at your school or place of work. Get your friends and co-workers involved. Visit secondharvest.org to find out how you can help. Together, we can end hunger in America.
I am a walking, talking miracle.
I am here because I survived leukemia,
lymphoma, Hodgkin's disease, myeloma.
I am here because of my strength,
my faith,
my treatments.
I'm here because of you.
Thanks to support for the Leukemia and Lymphoma Society, the survival rate for these cancers has nearly doubled in the last 40 years. Please help us keep the research going. Call 1-888-HELP-LLS.
I am a walking, talking miracle.
I am here because of you.
Welcome back to Mental Health Matters. We're joined today by Dr. Diane Ossip, who is a board-certified psychiatrist and the medical director of Baltimore